Now, there are two very effective treatment approaches for children and adults who have OCD. Now, the single most effective treatment that we have is something called cognitive behavioral therapy with exposure and response prevention. That exposure and response prevention piece is critical to it. And if you're not doing that, then you're really not doing the type of treatment. Now, very simply, all exposure and response prevention is where you work with a therapist to face your different fears in a gradual, systematic manner without doing the rituals or without kind of escaping or avoiding the fear triggers. Over time, you repeat those different tasks, which we call exposures, without doing the rituals, and you take on progressively more challenging types of stimuli. So, for example, if someone was afraid of something that had germs, what we might do is have them touch something that was a little bit germy without washing their hands, and then touch something that was a bit more dirty without washing, and then touch something that was very dirty without washing. And these might occur in different sessions, not all at the same time. Now, another very effective treatment involves medications that are usually antidepressant medicines. These types of medicines are widely available and effective in treating OCD in both children and adults. Now, sometimes people want to focus more on the behavioral therapy as opposed to medicines because of side effects or feelings about different medications. At the same time, sometimes people don't want to engage in the exposure therapy because they may not have access to it or they may prefer to try medications first. The key is engaging in really at least one of these forms of evidence-based intervention as soon as possible, as soon as you're aware that OCD is in the picture. For those that have the most severe symptoms, what we want to do is combine these treatment approaches to really increase our chances of getting the best bang for our buck.